Good evening, once again, beautiful people. We are at the Icon Health Clinic, and we are starting with the prostate cancer seminar. Thank you all for making time. I'm Dr. Nelson. I'll be doing this presentation with Aldi Pamela, also at the Icon Health Clinic. So, please feel free to take notes, and then at the end of the seminar, you can ask your questions and make some suggestions and contributions. Thank you very much. Okay, so we want to look at the road to causes, prevention, and treatment of prostate cancer. The overall, we are looking at the general view, which is the epidemiology, the etiology, the risk factors, signs and symptoms, stages, complications, prevention, treatment, and conclusion of what we can do. Okay. Surprisingly, though prostate cancer is one of the leading causes of death, many people do not know anything about it. It's important that we know what prostate cancer is about. So prostate cancer is when the cells develop changes in your DNA, leading to the formation and accumulation of abnormal cells, which forms a tumor. Now, you know that tumors, we have benign tumor and we have cancerous tumors. The prostate itself is a walnut-sized gland that produces seminal fluid. Okay, so when you seminal fluid is that fluid, that lubricating fluid, okay, that comes with the sperms. The seminal fluid nourishes the sperms and helps them in transportation, just as I said. Now, prostate cancer is one of the most common form of cancer in men. It is also the leading cause of cancer-related mortality in men all over the world. It's not just one side of the world. It is mostly prone to elderly people. People from age 55 going are more than 15% likely to develop prostate cancer. And people below 55 have just about 0.03% likelihood. But let's see, in some cases, younger people can also develop this condition. So it's good to know and to prevent ourselves from developing it. Now, someone says prostrate. Prostrate, there is something in men. How about women? We realize that women also have a gland which also acts as if it's a prostrate, or it acts like prostrate in women. So this gland is called Skin's gland. Now, skin gland also is prone to developing some kind of cancer. Even though it's rare, it happens. And the symptoms of the skin gland cancer is similar to the symptoms of prostate cancer. Though we'll look at other conditions, infections and stuff that can lead to inflammation of the skin gland, which will also have the same symptoms as the prostate cancer. So it's good to, check what might be happening. Sometimes having a UTI or having a problem in your pelvis or something, having pain in your abdomen could mean other things other than just infection. It could also mean that you are developing a cancer. So it's good for us to check. Now, in the year 2020, prostate cancer was one of the most commonly diagnosed cancer in men, with more than 1.4 million people diagnosed worldwide. Now, we are, as I said earlier, for people below the age of 30 years, less than 5% of them are likely to develop this prostate cancer. And for people who are above from 79 going, more than 59% are likely to develop it. That is why it's very important for us to be checking on our health. Africa, however, was the fifth continent to record high prostate cancer in the whole world. Okay, so we realize that most Western countries also develop prostate cancer massively. Ghana is one of the countries that also experiences prostate cancer. Now, prostate cancer in Ghana is one of the leading causes of cancer in men in Ghana. After breast cancer and cervical cancer, we are talking about prostate cancer being one of the major cancers that people develop in Ghana, especially in men. There were more than 2,000 prostate cancer cases recorded in 2020 alone, with more than 1,000 of them dying from prostate cancer. When you take 100,000 people, we realize that Europe or North America has the highest percentage of people developing prostate cancer, which is 130 people out of the 100,000 people. So any 100,000 people you take, more than 130 of them have prostate cancer in North America. And Africa is like one of the lowest rated countries that have prostate cancer. Aside that, Africa has more complications of prostate cancer or cancer in general because there may be other cancers that will contribute to the person's morbidity. So it's important that we check for other cancers as well, even though Africa is appearing here as not having a high prevalence of prostate cancer. We have challenges such as getting the right treatment, early diagnosis, and stuff, making it one of the what's the name? One of the leader cancers in Africa. So it's important to find out early what might be happening in your system so that you can be able to resolve as soon as possible. J. Adams, he was the first to discover prostate cancer in London, in a hospital in London. And then he discovered it by histological examination and reported that it was a very rare condition. Now, after so many years, we realize that it is one of the most commonly diagnosed cancer in men worldwide, especially even in the USA. And now, when you look at the picture here, you will see the normal prostate. Okay, you see it as a round thing around the urethra. Okay, the urinary tract in men. Okay, you can see the penis and you can see the prostate coming all the way from the bladder, and then the prostate is what's the name? The normal prostate is just around it. You see secreting seminal fluid and everything. Now, when you look at the enlarged prostate, where the prostate cancer is, you realize that the prostate, this small prostate, has become bigger. It has increased in size, like as if it's inflamed. But this one is cancerous. About 180,000 new cases of prostate cancer are recorded annually, with more than 31,000 deaths in the US. And in Ghana, like we said, more than 2,000 people die from the condition almost every year. This is very, very serious. And this is something we can do something about. So it's important that we do something about it. It is discovered that the increased incidence may be related to the westernized way of living. Nowadays, more people want to take fast foods. You want to eat fast prepared diets, and we don't have time to, eat vegetables and fruits and things that would, give the body the nutrients it needs. Okay, so these things are leading to all sort of cancers in many people. The increased incidence has led to remarkable changes in the diagnosis and treatment of prostate cancer over the past few years by doctors and researchers, because now we are getting to know more about the condition. So its treatments and stuff are becoming more and more advanced. The cause of prostate cancer itself is unknown, but we realize that there are some modifiable and non-modifiable risk factors that can be taken into consideration. When we are talking about risk factors, we are talking about race of the person, the age of the person, the hormones and chemicals that the person is exposed to, the diet that you take into your body, and the family history. If your family member has it, you are also likely to develop it by fourfolds. Okay. So with the age, like we said before, people who are older are more likely to develop prostate cancer. So usually people between the ages of 60 and above, like we said, have more than 10% chance of getting it. Okay, and people who are less than 30 years, only few have the chance of getting it. Between 40 to 50 years, more than 2% chance of getting it. But still, if you don't look after yourself well, you can develop it still. Now, with a family history, men with a father or a brother diagnosed with prostate cancer have 2 to 4-fold risk of developing prostate cancer. Now, recent studies have also suggested that increased risk of prostate cancer in families with breast and other cervical cancer and other traits of cancer increases the risk of prostate cancer by 21 and then 68% when we consider the various cancers. Now, risk factors, as you know, most of these conditions, smoking and drinking is one of the toughest risk factors. Obesity and metabolic syndrome are also part. So if you are a person or a man who smokes or a woman who smokes, it's very important that you either quit or do something about it. Because even non people who have stopped smoking, which are ex-smokers, they still have the higher rates of developing prostate cancer. And then people who are heavy smokers have more than 30% chance of getting it and then even dying from it. For those who drink, they have higher rates compared to those who do not drink. For every increase in 5 kg in BMI, we have about 20% increase in the probability of developing prostate cancer and even dying from it. So if you have a higher BMI, you are obese, it's very important to work on it. The more you work on it, the better your risks that you are reducing. So summary: physical inactivity, improper diet and nutrition lifestyle. Taking medications, some medications could also expose you to prostate cancer. Sex and vasectomy could also lead to prostate cancer. Some hormones are also likely. So if you go for hormonal therapy and other stuff, and then the testosterone or progesterone levels are changing in your body, you could also have more risks of prostate cancer. The ethnicity could also expose you to prostate cancer. That means we are talking about more of the westernized people being exposed because of diet and other stuff. But Africans are also at risk, as we said before. Now, with sex, we're saying that people who have more than 10 partners, 10 sexual partners, have more than 1.1 folds of developing prostate cancer. So the more sexual partners you have, the higher your risk of prostate cancer. And then also, it's also important that at least every week for a man, if you have 2 to 4 times of ejaculation or sexual intercourse, it helps the prostate to work effectively, you see, and it reduces prostate cancer. So sex, moderate, 2 to 4 times in a week will help to what? Also be like, it's just like exercise. But this time around, because the prostate is the one circulating the seminal fluid, you are always making it work well. So the signs and symptoms, if you see blood in your urine or in your semen, then know that it may not just be infection, there could be element of prostate cancer. So you need to go to the hospital for a medical checkup and see what the problem could be. Trouble during urinating. You are urinating, it's not always going to know that it's painful. Prostate cancer can also lead to pain. You saw how the prostate was impacting the urethra because it was bulging, it was expanding. So it could also cause a problem during urinating. Now, discomfort in the pelvic area for women and for men, if the prostate is enlarging, it could, what's the name, develop pains in the pelvic area. Painful sensation during urination, just as we said, difficulty in passing urine. If you are finding difficult to pass urine, or impotence, you cannot even erect. Morning erection is not coming. sometimes it's not just about going to take those herbal medications to get the strength to fight out. It's also about finding what the problem is and solving the problem. If it is prostrate, it's better because of your life. It's better to find a solution to it. I'll let Pamela take over from them and then give us more on prostate cancer complications, prevention, and treatment.
I'm Pamela, and I'll continue from where Dr. Nelson left us. Here are the stages of prostate cancer. We have 4 stages of prostate cancer. We have the stage 1, stage 2, stage 3, and stage 4. In stage 1, the cancer is small and is only in the prostate. And then in stage 2, the cancer cell begins to enlarge, but it may be in the lobes of the prostate, both lobes, but it's still confined in the prostate. In the stage 3, the cancer will begin to spread beyond the prostate to other closed glands and then also the seminal vesicles. And then we have the stage 4 where the cancer has spread to other organs such as the bone and is referred to as metastatic cancer and the cells in the bone as well as, but not bone cancer. So now we move on to the complications. Prostate cancer can lead to varieties of complications, and some of this include the organs, the prostate cancer spreading to the bladder or traveling through your bloodstream or through the lymphatic system to other organs in your body, thereby causing other health risk, as well as cancer developing in other organs as well. It can also get to the bones and then begin to cause pain and then broken bones as well. It can also lead to the loss of bladder control. That is, it varies from a slight loss of urine to complete inability to control urination. It can also lead to erectile dysfunction as well. So it is also where when one gets erectile dysfunction, it progresses mostly to the person being infertile. It can also lead to fatigue. In this case, mostly treatment of prostate cancer can lead to low red blood cell count in your body, thereby affecting your energy levels. So you mostly feel tired and fatigued and worn out. It can also lead to weak bones, like I said earlier, where the prostate cancer spreads to the bones. And aside it causing pain too, it can make your bones weaker. That's because when undergoing treatment or when the cancer spreads, it affects your testosterone levels. So once it affects the levels, your bones becomes weaker and also you have increased risk of fractures. It can also lead to eating and digestive problems. It can lead to infertility. It can lead to death and as well as recurrence of the cancer. That is if it's not detected earlier. So we move on to prevention of prostate cancer. It is important for you to quit smoking. If you cannot quit or stop smoking, it is good if you can at least minimize the quantity that you take in daily and also be physically active. You stay at a healthy weight and then you eat at least 2.5 cups of wide varieties of vegetables and fruits each day. Then you make good choices about your fats. The fats that you take in, it could be your oils or maybe your margarines or butter that you take in, but you should make sure you are taking in healthy fats. Especially with the saturated fats and then the trans fats, it is very essential for you to avoid them in order to stay away from prostate cancer. Then you also go for medical screening tests regularly. So continuing, it is essential to engage in regular checkups for early detection if you're at risk, especially when you begin to age or you know you have a family history of prostate cancer. It is very essential for you to engage in regular checkups. Then avoid smoking and also avoid alcohol abuse, as it also serves as a risk to developing prostate cancer. Then you maintain a healthy weight and a healthy BMI, because studies have shown once someone is getting overweight or obese, that individual begins to develop certain risk of getting cancer, and any cancer at all can just um, come into the system. So it is very essential to maintain a healthy weight and then a BMI, and also maintain a healthy lifestyle to prevent certain metabolic diseases such that can lead to cancer development. We know metabolic diseases are just cluster of many conditions. It can be a cluster of maybe hypertension, diabetes, and the likes. And once you get all these diseases, you are also prone to getting prostate cancer. You also engage in regular physical activity and know what goes on inside your body, like goes inside your body, as you know what you are eating. Then you also practice safer sex and avoid risky behaviors. So we are going to talk more about physical activities and then the diet. So numerous studies have been conducted and have shown an inverse relation between physical activity and prostate cancer. That is, you engaging in physical activity a lot more can help you reduce your risk of prostate cancer. So a study was conducted among 2,705 men who had the case of prostate cancer, and it revealed that some of these men had taken 3 hours of vigorous exercises per week, and some others didn't. Some others also did, but they didn't meet up to the 3 hours of the vigorous exercises. And at the end of the study, it was known that 61%, there was 61% reduction of prostate cancer specific mortality in the men who engaged in the 3 hours of vigorous exercises per week. So it was known that if even physical activity among those who already had prostate cancer can help reduce the risk of mortality, then if you do not have the condition and then you engage in regular physical activity, it will even prevent you from getting this cancer disease. So it is very essential to practice regular physical activities, as it helps in weight loss and also helps in regulating the makeup of the body as well as the immune system. So engaging in at least 30 minutes of regular physical activities, it could be aerobics, it could be muscle strengthening exercises daily, can help you reduce the risk of prostate cancer. Then we move on to the diet and nutrition. So many studies as well have investigated the association of prostate cancer with what we eat. Mostly known that in the Western countries, they tend to develop more prostate cancer cases as compared to the Asian countries and then the African countries. And regular consumption of fatty foods, trans foods, processed foods increase one's risk of getting cancer diseases. So it is very important to engage in foods that are not very well processed, engage in you should take in more foods that are rich in fiber to help reduce the risk of prostate cancer. It is also important to consume a lot of vegetables and fruits. When you get your plates, you should at least let half of your plates come from fruits and vegetables. You should also increase consumption of foods that are rich in lycopene, and it can be found in foods such as tomatoes and watermelon, and it helps reduce the risk of prostate cancer. You can also increase intake of soy foods as it contains some levels of isoflavone, which combats to help reduce risk of prostate cancer. Now, you can also increase consumption of calcium-rich foods. Calcium is good for the bones. And then one main good source of calcium is dairy foods. But then studies also shows that excessive consumption of dairy foods can also increase your risk of developing prostate cancer. So when you are going in for the calcium-rich foods, you try and get other sources than going more for the dairy products. You can go for a minimum quantity of that, but not too much. You can also increase consumption of omega-3 rich foods, such as fresh fish. This help reduce inflammation and also help reduce risk of prostate cancer. So now we move on to treatment of prostate cancer. There is hormone therapy, where a hormone is either removed or added to treat cancer. There is surgery, where you can be operated on for the cancer cells to be removed. There is chemotherapy, there is targeted therapy, radiation therapy, immunotherapy, and then medications, which are also given to you to help treat the cancer. So, in conclusion, prostate cancer can cause many devastating effects to an individual. It is therefore important to be in the know to prevent you from being at risk of it, as well as taking immediate action once you are diagnosed of it. Thank you.
Thank you. With regards to the sex issue that you said it can cause cancer, prostate cancer. I've seen it somewhere and they said that sex is not a risk factor for prostate cancer. So I don't know. I think there was a study done by European urologists. Is it 2016? They said sex cannot cause prostate cancer. In fact, some people are even saying that it rather reduces the risk for prostate cancer. So I don't know how, because in your presentation you said that sex can be a risk factor for prostate cancer. So I want you to explain further why you are saying that it can be a risk factor.
Okay, so what we said was that sex, when you have sex with multiple partners, it can lead to prostate cancer. In our research, it says sex with more than 10 partners can give you 1.1 fold increase. That's 10% increase in developing prostate cancer. And then sex weekly between 2 to 4 ejaculations per week can help to reduce the risk of prostate cancer. Now, when you have sex with multiple partners, you are likely to develop infections, and then you are likely to even develop the big man, which is HPV, which is the source of cancer in both men and women. So the fact that you have multiple partners would expose you to getting infections that create room for developing the cancers, especially unprotected sex. So this is where infectious disease comes to meet non-infectious disease, which is a cancer, and it can lead hand in hand to increasing the rates of cancer. But like you said, when you have sex often, which is weekly, and it is within with one partner or with your trusted partner, and it is below, it's between 2 to 4 times ejaculation, is healthy. It's termed as healthy. It doesn't stress the cells. It doesn't stress the prostate gland, and this would help to reduce its likelihood of getting cancer. I hope it's understood now.
Yes, I'm okay.
Okay, please. Thank you very, very much. Now, someone also asked if the slides could be shared. It will also be on YouTube, Icon Health System on YouTube. You can subscribe there and receive the slides as well.
Hello.
Yes.
Good evening.
Yes, evening.
Please, I couldn't join from the beginning. I was asking about the signs you'd see to know that, okay, I have prostate cancer.
Okay, so we've highlighted them here, which is blood in the urine or semen. If you have sex and you see blood in your semen, it's not supposed to be. If you are urinating, you see blood in your urine, it's not supposed to be. If you have difficulty in urinating, it's painful, it's discomfortable. You have discomfort in the pelvic area and painful sensation during urination, or you find it difficult to even have sex or to even erect, it means, this for men, it means that you have this thing. Prostate, it could mean that you have signs and symptoms of prostate cancer. If you have pain in your pelvic area, pain in urination as a woman, painful sensations, it could also mean that you have prostate cancer. Yeah.
Okay, thank you so much.
You're welcome.